Good afternoon, everyone. My name is Christian Gallardo, VP of Sales with iPros Insurance Professionals. We have here today LA Care covered. They're going to give an update to all of you on the upcoming commission updates and any other updates they have in terms of network and bonuses, etc. So with that, I'll hand it over to the LA Care team to introduce themselves and let us know what's new.
So from here, thank you, everybody. Thank you, iPros team, for allowing us to be here today. My name is Patricio. I'm the manager of territory sales alongside Karen Rios, which is my counterpart. So we are here to assist you with any assistance that you might need regarding events that you have in the community, any connections that you have with that you might need with doctors' offices in the community, or events that you need assistance with. We are here to assist you. Materials that you might need, let us know, reach out to us. We also have 3 territory sales reps under each one of us. So Karen has 3, I had 3, and some of you guys might already know them. Gohar, we have Scott Casey, we have Eduardo Martinez, we have Ray Antonio, we have Bruno Aguirre, and we have Faye Jahangir. So we have 6 territory sales reps here to ready to assist you, as well as Karen and myself. We are here to help you with any community activities that you might have. So LA Care has been providing insurance since 1997, when the state of California created LA Care alongside other county plans such as CalOptima as well as IEHP. We are the largest public operated plan in the United States. When I say publicly operated, I'm differentiating ourselves from private plans or plans that are not public entity. So we are the largest public entity providing insurance to more than 2.9 million members through the different line of businesses that we have, such as Medi-Cal, Covered California, and our Medicare Plus line of business. LA Care has been participating in the exchange, or here in California, we call it Covered California, since it was created in 2013 and implemented in 2014. And since then, we've been one of the most affordable plans that the members that can have access, or they want to choose Covered California as their insurance, they have access to. So health equity. So this is a big item for LA Care as a public entity, and it is to support the different minorities, to support access to care, access to quality care, and access to insurance. LA Care not only provides insurance, we also, as a public entity, provide supports to doctors to go. I mean, as you know, there is a deficit of physicians in the community, so we provide and support those students, medical students, that they want to finish their degrees, that they want to become doctors. We support that. We provide a certain amount of several millions of dollars to assist them to finish school, with the commitment that they are going to be providing care in low-income communities. We provide also assistance to housing, food, and other social services that the community needs. So we try to elevate the safety net. So through the different activities and the different engagements that we have with community health organizations, as well as federally qualified agencies and community clinics, we try to support them so they can keep operating and providing care to the low-income communities, as well as our collaboration with different public agencies that support housing, support food and income security for low-income communities. Going to Covered California. So when it comes to Covered California, LA Care is #1 in price position. As you guys know, I mean, you guys can go to Shop and Compare and see that yourself. LA Care is the plan in the different tiers, from bronze, silver, gold, and platinum. We have the lowest price position. We have no more deductibles for 2024. We are going to be talking about your commissions and the family glitch that has been fixed and allows for members for example, to the head of household to be in their employer plan and the family to be in Cover California and receive, have access to the subsidies that California offers to those that enroll in Cover California or in the exchange. So when it comes to letting you know how the commitment of LA Care to assist and to support and to continue being being ahead in a price position. So LA Care for the last several years, the average increase in rates has been 9.6% for other plans, while LA Care has only increased 6.1% in our rates. So that shows the commitment of LA Care to keep our price low and affordable for those that are low income and not in need of insurance and healthcare. So as you guys can see, as you know, in California, in Los Angeles County, Cover California divides the county into regions, Region 15 and Region 16. In both regions, LA Care has the lowest price position. As we can see here, we have the silver plan for a person that is 40 years old. So LA Care has the lowest price position, and there is no deductibles. The same thing for platinum, for gold, and for bronze. So we go to the next regions, which will be Region 16. The same silver plan for gold, bronze, and platinum. We are the lowest price position, and we also, there are no deductibles for those tiers. Okay, so here is one example. So there is a silver 70 plan, pays 70%, as you know, pays 70%, and the member pays 30% of the cost. So we enhance this plan. Silver 94 plans pays 94, Silver 87 pays 87 with LA Care, and Silver 73 plan the plan pays 80%. So this is how much we pay in those different plans: Silver 97, Silver 87, and Silver 73. So these are more examples. And Silver 73 for a FLP, family poverty level of 200% to 250%. For a family of 4, let's say mom and dad plus 2 kids, with an income of 60,000 to 75,000, which is pretty significant for a family that is 4 and they only make 75,000. So it's Silver 77. That will be that's how much they will be covered. Silver 77, the same case, but obviously we see more affordability here. And Silver 97, which is the one that we really want to push, we see that is lower than the previous silver plans. If the client is eligible for this Silver 94, this is the plan that we want to push, and not so much that we want to push, but is the ideal for this family of 4 in this federally poverty level. So now we talk about the family glitch. So as you know, in January 1st of 2023, the IRS issued a new rule that revises the previous interpretation for affordability for employer-based coverage based on the total premium cost for the entire family. So this is going to allow, in few words, this is going to allow that if a family that has currently employer insurance, they want to also be evaluated or they have access to a quote to participate in Cover California, they will be able to do so. Could be that the dad or the head of household can stay in the employer insurance and the rest of the family can be part of Cover California and have access to the different what we call them, the subsidies that Cover California provides to those members and have access to insurance and affordable care. So now that transitions to the commission part. I mean, LA Care, as you guys, after what you guys have listened or what you guys have heard about the commitment of LA Care, we're going to be talking about commissions, but it is is part of LA Care commitment to our members, commitment to the community, and also commitment to our agents. So with that, we're going to transition to Ricardo. He's going to be talking a little bit more about the commission.
Hey, thanks, Patricio. Yes, everyone's favorite topic, right? Commissions. Now, as you can see, right, for those who have been with us, LA Care, selling our products, right, you can see the changes. LA Care, we've had, a pretty unique model where, we were the lowest price plan and one of the highest paying commissions on the exchange. And, as Patricia mentioned, right, to really sustain our price point, our affordability in the market, and our commitments to our members, but also, to continue to support you, the brokers, for, the growth, your efforts, and all the time you put in, day out, supporting our members and growing our plan. I myself, was also a rep for over 15 years. So definitely know, the grind, right, that you guys put in the field, and the late nights, writing business. But as you can see, we've had to make some changes for agent commissions. Our agent commission for new members is still at the top at $20 per member per month. So again, highest pay, I believe, between plans. Now, renewing membership, although still very, very competitive, has been reduced from $20 to $15 per member per month. So on the returning side, so what that means is a return member is someone who's had a gap in coverage, or a lapse in coverage, right? With some other, but that would be someone that has to make another binder payment. So they were with us at one point, and then they left for whatever their reasons, and then they now have to issue a new binder payment for their coverage. So what does that mean in terms of commission? So in terms of commission, we'll redefine that member as a new member if they last terminated beyond the last calendar year, right? So I'll just give you an example. So in this scenario where right now these commissions were in place for 2023, that would mean that if the member was with us in 2021, 2020, or prior to that, that would be classified as a new member. Now, if they were with us in 2022, at any time during 2022, they would be classified as a renew member, right? But now, again, these commissions aren't taking into effect until 2024. So what that means is instead of 2022, it'll be 2023. So again, anyone that's with us this year, 2023, and there's a lapse in coverage next year, this year, right? Then again, according to that rule set, that's how they'll be defined as new versus renew. We're still working on the bonuses side, so keep your eyes out for that. We are getting feedback from our partners regarding bonuses. So again, so whatever we can do to try and make up the difference in loss and commission there. So we'll be working very closely with our partners on the bonus side. So stay tuned for that. But again, we definitely know, right? You all work tirelessly for our members. Again, LA Care, we continue to prioritize, quality, access, inclusion, everything, right? To really elevate all of LA County. Our territory team with Patricio, Samira, they're here to support you. Our agent support team is here to support you. And again, we really thank you for all your growth throughout these years. But having said that, if you have any questions, if you can go to the next slide, Patricio.
Yes, Ricardo.
Our member services team is open, once again, 24 hours, 7 days a week. Agent support is also open, extended hours during OEP. So they'll be open from Monday through Friday from 8:30 to 7. And then Saturdays are also open from 8:30 to 2. Territory sales is an extension of agent support where they're supporting you out in the field with your doctors, with your events. Any questions about benefits, right, or coverage, things like that, definitely outreach to them. They're your subject matter experts and are always happy to support you. Next slide, Patricia.
Thank you, Ricardo.
And then real quick, for anyone that's new to the team here, just real quick, we'll go over the quick 1, 2, 3 steps here to get appointed with LA Care and iPros. So again, you'll be obtaining step one is the basic thing, right? Is you're getting you're obtaining your life and health license. Step two, you're going to get certified through Covered California. So that's very important to get you what they call a PBE certification. So you just click on that link, you follow the steps, and then you'll get certified through Covered California. You accept the terms and conditions, attestations, etc. Then you move forward to LA Care. At that point, you'll go to our website. Go to the next page, Patricia. You'll go to www.lacare.org/agents, and then you'll click on get appointed with LA Care. At that point, you'll be choosing what line of business you're looking to get appointed with. You'll be choosing the LA Care Covered Plan. You'll be selecting iPros. You click on Apply, and then you'll fill out the application. The application is just your standard information, name, address, license number, address. You'll be accepting the attestation, and then you move forward from there. At that point, anyone that does submit this does get reviewed by our agent onboarding team, by iPros, ensuring that you're fully licensed and we have all your documentation, and then you'll be move forward. You'll be then pushed forward through the approval process. And with that, I believe that is it. Any questions for the folks here? I don't know if they can unmute themselves. Christian, is that possible? Get some feedback from any agents.
Let's see here. I believe I've allowed all of them to speak now.
Right. Did you have, if you're still a company.
Sorry, we cannot hear you. Can you repeat the question?
If anyone has any questions for the LA Care team regarding the changes for this year, now's the time. Again, regardless, we're recording this, so we will be sharing it with all the agents that aren't on the line today, which we have quite a few. And as you all know, they're probably dealing with the last couple of days of renewals. I guess on behalf of some of the agents that I've spoken to, kind of going to ask you one of the hardball questions, Ricardo. Could you elaborate a little bit more on LA Care's decision to drop the renewal rate from $20 to $15 per member per month? Some of the thought process there. That way we can distribute this to the rest of the agents.
Yeah, definitely. It wasn't an easy decision that we had to make. It wasn't, it's something that, we have to, work through with our management team, to really sustain, our price point in the market. That's one thing that we've definitely, I think, fight year over year, trying to maintain our commissions, our price point. And then, we've done it, I think we've done it consecutively, right? We've done it consistently where, other carriers who come in and out of the market, other carriers, the price point is up and down. And I think really to really be about our mission, right? To be about our mission and everything that we do at LA Care, affordability. We have to make those changes, in alignment with management to continue to drive, that position that we have in the market to continue to be affordable. But again, it's not something that we really wanted to do. We're, consistently getting feedback from our agent partners, definitely hearing them out, taking that feedback, taking it into management. So again, any constructive feedback that you can provide to us, your thoughts, please send those our way. We are, compiling that feedback, getting that over to management. So definitely your feedback matters, because again, if it affects you, it's definitely going to affect us as a sales team here at LA Care. So again, we're definitely with you. We share your frustrations. But yeah, to answer your question, Christian, it's really come down to, putting us at that, continuing to put us at that number one position in the market and continuing to make it affordable for our members in LA.
And I like to add, Juan Gallardo here, I'd like to add that we were part of the process alongside LA Care in looking at making those changes. So obviously, we advocated for the agents on minimizing the impact. So I think collaboratively we did a phenomenal job of keeping LA Care very competitive in the market. If you look at some of the higher paying health plans, LA Care still continues to be one of the top commission paying companies. So still great opportunities. You see some of the other carriers experiencing some significant premium increases. Blue Shield comes to mind when you look at a 15 to 18% premium increase. LA Care continues to be a price leader, has one of the most robust networks in both region 15 and 16. So I think that given some opportunities that are happening now in the marketplace, we will continue to grow with LA Care. You as producing agents will continue to grow with LA Care, hopefully offsetting that slight adjustment in the renewal. And I'm happy to say that they agreed to keep the $20 year one commission payment to minimize the impact.
Yeah, and to add to that, again, more to come on the bonus side. Again, anything that we can do to minimize that impact on the renewal side. So we'll be looking to increase our commissions. Last year we did increase our commissions, and then we'll be looking to increase the bonus side of it once again for 2024. So stay tuned for more information on that.
Ricardo, some of the feedback that I've been receiving regarding renewals is that if they're going to be impacted by the drop in renewal commission, that there be some kind of retention bonus that might reward them for that effort that goes into renewing clients. Just some feedback I wanted to provide there, either by percentage or amount of lives.
Exactly. Yeah, most definitely. We definitely heard that as well. We'll definitely be looking into a retention bonus or renewing bonus, right? To again help alleviate that. But yeah, thanks for that feedback, Christian. We'll definitely look into that.
Well, with that being said, I want to thank you and want to echo Christian and Ricardo. I mean, the community outreach team of the sales team, Karen and myself, we are here to assist you with any community events or any activities that you might be, that might come your way, and you want to reach out to us to support you, either with participation, with any booth fees that you guys would like assistance and access to increase your book of business. Let us know, and we will be able to see what we can do to assist you.
Thank you, Patricio. Thank you, LA Care team, for your support as always. Again, for the agents on the line, we're going to distribute the recording from today's session. But if you do have any comments, feedback that you'd like us to share with the LA Care team, feel free to email us directly and we'll go ahead and let them know. With that, thank you so much for joining us. LA Care, once again, thank you for your partnership, and we'll be in touch.